Testing, testing, I'm on. Good morning, everyone. I see the green light is on, but we're all still kind of getting organized with our coffee. I'm getting a little bit of ringing back here, John. Thank you, sir. Well, welcome everybody. This is always such a well-attended program when we do these panel presentations because it's so relevant to resident life here, and things change, and we always have questions, and we always have people new to the community who want to know about our skilled care, about our assisted living, about our memory care programs, our wellness suite, and other programs we offer on campus. So today I'm going to be your moderator. I did have a copy of my questions. Would you like to borrow these? I thought I had a copy of them. Sorry. I did print out a copy. I must have just taken them straight back to my office. How about that? Well, I think a great way to start out while everybody's kind of getting caffeinated and getting their biscuits. I know everybody's happy those biscuits are back. Thank you, Chris and the team. We appreciate that. I would like to have the panelists take a moment to introduce themselves. So maybe starting at the end with Tammy, introduce yourself, let them know your role and your time of service here with Linear Village Estates.
Well, good morning, everyone. Thanks for coming out this Friday morning. We are so excited to be here. We're glad that you're here. We can't wait to share our information with you about who we are and what we do. It's a beautiful place to be. I couldn't be happier here. My name is Tammy Stith, and I'm the administrator of Resident Health Services, which includes our skilled nursing facility, which is 64 beds, that's Willowbrook, and then our assisted living, which is 50 beds, and then there's wellness home services. And you see these ladies sitting to my left here, they're all going to share their details about how they're set up in their areas, how they operate, and if you have any questions, we welcome all your questions.
All right, we're just going to move on down the table. And I'm going to talk to you before we start Q&A about the terms of engagement for Q&A, because there's a process, but we'll let the rest of the group introduce themselves first.
Hi, everybody. My name is Rhonda Hay. I've been with ACT since 2010. I am the director of our assisted living, Oak Bridge Terrace. And we're open for tours any day. If y'all want to come by and look, I'll be happy to show y'all around. I'll pass it on over to Madeline.
Thanks for the mic. Good morning. My name is Madeline Terry. I am the director of Willowbrook, and I'll be happy, as Rhonda said, to give you tours, to allow you. Yes, sir, I got you. Make sure that I have this mic at the right place, you guys. Sorry about that. Once again, as I was saying, my name is Madeline Terry, and I am the Director of Nursing at Willowbrook.
Good morning, everyone. My name is Lucy. I'm the Director of Wellness Home Services, and I've been here about 3 years now with Linear Village Estates.
Good morning, everyone. I'm Angelie Tipton. I am the nurse practitioner, and I'm here representing the primary care suite. I've been here almost 8 years.
And I'm Vicki Doherty, your Life Engagement Director, the Julie of your love boat, and this morning I am your moderator. So a couple of housekeeping things. We have a series of very commonly asked questions that I'm going to roll through and have our team answer, and we'll have a period for Q&A at the end. A couple of asks. When it comes time to ask a question, please hold your hand up and one of the mic runners will come bring you a mic. Please wait to ask your question until the mic is to you, and make sure you hold the mic close to your mouth. We record these sessions so people who can't make it here today can hear your important questions and all of the answers. I would ask if you have a follow-up question, because we usually take the mic. Rather than speak without the mic to ask your follow-up, you raise your hand. Also, there may be somebody who we're in the process of allowing to ask a question. So those are kind of like the rules for question asking, so we can capture all your wonderful questions so that the residents who listen to it later will be able to hear them clearly. So we are going to start with questions about OBT. So first question for whichever panelist would like to take it. How many apartments are there in OBT?
There's 50 apartments in Oak Ridge Terrace. There are 8 on the second floor that have 2 rooms in them. The rest are like little studio suites. And then upstairs in our memory care unit, there are 20 beds. And there's also 8 one-bedrooms upstairs as well, which has the sitting area and a sleeping area.
Excellent. Next question for OBT. What does staffing look like in OBT, and what roles do they play in resident care?
So staffing on the second floor, we usually have 2 certified medication aides, and what they do is they make sure that you're getting all your medication on time when the doctor has ordered it. They play 2 roles. So they are also a certified nurse aide, which means they are allowed to help with showers, dressing, they can make your bed, any little things that you usually can't do. Say, I can take my shower, but I can't put my lotion on my legs. They'll come in on the day you take your shower and offer to help you and do that. So the ratio on the second floor would be 2 CMAs to 50 residents when we're full. And there's a RN there Monday through Friday, 8 hours a day. And then 2 days a week, there's a RN there from 7P to 7A, because we also have an RN that works night shift for us. And then we have an LPN pretty much 24/7 on site. And upstairs for the 20-bed, our memory care unit, there's a nurse at the nurses station all the time. That's manned. There's always a nurse there 24/7. And then there's also 2 CMAs. Now up there, the roles are a little different. The CMA upstairs gives medication to all 20 of those patients. And then the other CMA, which is also a CNA, she helps with showers, dressing, and all that kind of stuff. Anything they need. She kind of floats around and helps the residents all day long. So that's the kind of the difference of the ratio.
So to clarify, second floor is OBT, assisted living, and third floor is our assisted memory care. And as we dive a little bit deeper, you'll learn the differences between assisted memory care in OBT and what memory care looks like in skilled care, because the level of assistance is significantly different. So moving on to questions about WBC clinical care. What are the staffing patterns in WBC?
Good morning. The staffing patterns in WBC is a little bit different. We have 1 nurse to 16 patients. We have 1 CNA for 8 patients, and then we have on night shift 1 CNA for 16 patients. But we try to be very particular about our care.
Absolutely, and that's of course because the level of assistance that's required in skilled care is much more significant than when you're in assisted living or even assisted memory care because of changes in mobility, cognition, and more complicated health issues. Okay, next question for WBC clinical care. What types of services are provided in WBC?
In WBC, you do have 1 RN that is in the building or on call for you 24 hours a day. That would be me. Our model is to make sure that it's very patient-centered, so we provide any skilled care that you couldn't do at home, such as your medications, IVs, any insulin shots, or anything of that nature. Wound care is also one thing that we really would provide for anyone that came to WBC.
Wonderful. Okay, so final question for this section. Are residents allowed to continue to see their outside specialty doctors, for example, their cardiologist?
in WBC, you can see your specialty doctors. We just ask you to please go through our lovely MPs here if you have just general practitioner questions, and our medical director. But any specialties that you have, if there's specialties with your wounds, if there's any specialties, like she said, the cardiologist, you are allowed to see those people. And we help you set the appointments and everything.
I remember from working there, because I worked there for a number of years, the work that the nursing team in combination with social services to make sure all of those appointments and transportation and everything got coordinated. So it's what a wonderful team we have. Now we're going to move on to some social services question. Unfortunately, Kathleen Honeycutt could not be here. Just like my son, her son's a North Hall ball player and had a big game last night and had a minor injury. So she's helping to take care of him, but go Trojans. So for the social services question, the first question is, what is the admission and discharge process like for WBC? Meaning, how does it work for a person to transition into WBC? Who wants to grab that? It's kind of probably a twofold question, right? Yeah.
Okay, they didn't tell me to these questions I would answer, but I'll be happy to provide some assistance with it. Normally, you are referred by the nurse practitioners if you are needed, or Kim, if you need to come to WBC. The process goes through the social worker. We try to obtain all of your records so we can get to know you before you actually get there. The other thing that we like to try to have, if you're coming to WBC, to have your medications packaged the correct way, which is a bubble package, because it's different from having a nurse count every pill. If you have a pill bottle that has 80 narcotics in it, we want to make sure that all of that is processed correctly. But the nurse practitioner and your physician, if you do need to go out to the hospital, we will need the orders from the hospital to have you admitted. We don't come back from the hospital and then say, oh, I feel like I probably need to have rehab. We actually need real orders for that. So we're more than happy. If you know that you're going out to have a procedure, just let us know, and then we can kind of coordinate with you, and I definitely will walk through the process with you.
And I'll piggyback on that. That is part of Kim's role as a nurse navigator. For those of you who may not know her, her name is Kimberly Watson. She is an RN that works in my office. She functions much like the case manager here, similar to what that role is in a hospital facility. So if you should go out to the hospital, if you go out by ambulance, an email is generated to all of us that are interested parties, letting us know that you've gone to the hospital. Part of Kim's role is to follow up with you while you're in the hospital. Typically, sometimes it may be a phone call to your relative or spouse. Sometimes we just follow you along in the computer system because we have access to Epic, which is the hospital's medical record platform. And we can follow you and see what you're there for and if it's going to be an extended stay, and kind of determine from those notes whether or not you're going to need Willowbrook. So Kim would reach out to the case manager at the hospital, let them know where you live. The hospital oftentimes thinks Lanier Village is straight assisted living, and they document that. If you ever read your notes, you'll say they live at Lanier Village, it's assisted living. Well, no, not necessarily. We have to relay to them that yes, you live in independent living, or indeed you do live in assisted living, or you came from the skilled facility, which is Willowbrook. So I communicate with the case managers that fact a lot because they get misinformation, just because they don't, a lot of the residents and doctors don't know about our community. So I educate them a little bit. So we follow you through that hospitalization, help determine by the notes and by the physical therapy evaluations and things in the hospital whether or not you're going to need a skilled stay. So that it gets communicated through Kathleen. She's kind of the bed czar. She lets us know how many beds we have open and where we can place people. So she's kind of the gatekeeper, and then we funnel that information onto the nursing staff as well, the supervisory staff, so we can prepare a place for you and hold a bed. The other scenario is if you know you're going to have a surgery, a knee replacement, a big back surgery, a big type of surgery that you might need a rehabilitation stay so therapy can work with you in a rehab capacity. We need to know that. And that way Kim can follow up. Sometimes you may not need Willowbrook, but we like to have a heads up just in case there's a complication and you do need that bed. We want to make sure that we have one earmarked just in case. And then, Kim lets Kathleen know that as well. A lot of times Kathleen will reach out to you ahead of time just so we know what your specific needs might be. That stay might be a week. We don't like to keep somebody in Willowbrook for a couple of days because we can do that, but that's not an ideal situation because there's a lot that goes on the backside, a lot of paperwork, a lot of those types of things. So we don't want you to be in a hurry to get home, okay? Yes, you want to get back home, but we want, especially if you live alone, we want you to be as good as you can be to go back to your independent living apartment so you can shower, you can dress, you can do all of those things. You have the luxury of living in a CCRC, that you have the availability of a skilled facility to do that rehab stay. So we're here, we can do that. We don't like to, what we don't want to happen is you go to the hospital, you think you're okay to go home by yourself, and then, oh my gosh, the next morning, and it's a Friday morning, you need to go to Willowbrook. That is a scramble because we have to have orders. If you're not my primary care patient, we have to call your surgeon or your primary care doctor or your somebody to get those orders because you can't get admitted to a skilled facility without signed orders. That's a state regulation. We can't just make that happen. If I'm your primary care provider, it's a little easier, but it's still a scramble. And we occasionally we have to make that happen. We had to make it happen within the last week. So and that's a all hands on deck, drop and run, and we get everything put together. We can do that. We don't like to do that because that's uncomfortable for everybody, including you. So that's why we like to be prepared and over prepare. So that's kind of the way we do things as far as admissions.
So these were answered through the lens of I've had a hospitalization or a medical emergency that has required WBC. We know that there have been situations where people need to transition into a higher level of living into skilled care, not because of medical injury, but because their level of assistance, what they require in terms of assistance, has increased. What does that transition look like?
So give me kind of a situation that you.
Okay, so somebody is living in assisted living and they're having more profound health issues, or they're having changes in cognition that would require them to move to another level of living. What does that look like?
Are you saying from assisted living?
Yes. Or even from independent, because we know there are times where people have required moving directly into WBC because of change in their health or mobility or cognition.
So level of care can change. Rhonda's team in assisted living by regulation can only do certain things. They're not skilled nursing. They can't do routine wound care. They can't do, if you had a tube feeding, if you had a tube in your belly where you had to get a tube feeding or something like that. By state regulations, they can't do that. So that's a skilled nursing stay. The other thing is, hypothetically, say your spouse lives in memory care and their dementia has progressed to a point where they need more help toileting and they're incontinent and those kind of things, and they just need more care than her staffing level can provide. That's the trigger to move to a higher level of care. In assisted living, you have to be able to get yourself out of a burning building. You got to get out of bed, and you got to, because they're helping some people, you've got to be able to get out. And Rhonda, correct me if I'm giving you misinformation.
Yep.
So if you get to a point where you're not mobile enough to get yourself out of the building, then that's a Willowbrook stay. We have, on the independent living side, we have couples whose loved one has some cognitive decline and some physical decline, and they've lived in the apartment and kind of kept them there, to a point where they've bypassed what assisted living can provide. So then that's a Willowbrook court placement, and that's a permanent placement. So that's another role for Kim. That's one of the purposes of Kim's annual reviews that she does, is to kind of assess where you are, assess where your spouse is, and are you in the right place? Because all of you moved to a CCRC to have access to these levels of care. If you get to a point where you need assisted living, if we've got a room, you need to go, because your lifespan and your abilities to take care of yourself longer can be supported there, and you can do that longer, and you can prolong the need for a skilled stay. So that, like I said, that's another role of Kim. You know, if you're struggling, if you're a spouse or you're living alone and you're kind of struggling with things, please reach out to Kim and kind of let us know that. We're not the big bad wolves. We're not going to make you move if you hit your pendant because you've fallen, okay? If you need help, that's what the pendant's for. If you need help, that's what Kim is for, is to help you assess that and help you determine if you need to move to a higher level of care.
I'm really glad
cover
that we talked about that, because I think that's like the elephant in the room that people want to avoid talking about. And I think it's important that we start having those conversations, because, you know, having worked in another level of living, life and social engagement and your lifestyle does not need to change because you've moved to assisted living. You have access to all the same lifestyle and programs that happen over here. It's just a change in location that offers you more support. And I think that we work very hard to keep people living independently in their private residence for as long as is possible and is safe. That is our goal. And just know the numbers. If you do the math, there's not a whole lot of room in the inn, so we're not in a hurry to move anybody to a higher level of living. So to reiterate, if you fall, if you're having challenges, that's not like we're gonna, okay, it's time to move to another level of living. No, the conversation becomes, what support does this person need to live successfully and independently on their own, until that clearly needs to be the case.
And hear me when I say this, an admission that you need help is not an admission of failure. It is not an admission that you failed yourself. It's not an admission that you failed your spouse because you can't take care of them anymore. That's, again, why you moved here, and you need to admit you can cry uncle. It's okay. Okay? Hear me when I say that. Kim and I have these conversations every single day. Every single day. That's what my office does. That's why we're here, to support you. And if you need help, don't be afraid to admit it, because it's not a failure on your part. It's a need. So hear me when I say that.
I love that. Thank you. Our wonderful Sherry Wilder could not be here today because she is under the weather, but I will ask her questions. I know that the team, I think Rhonda has all the answers that she was going to provide for you. First question is, what specialty programs are available from therapy services, PT, OT, and speech therapy for our community?
So she's got here that the first one is physical therapy, which is a customized exercise prescription for full body strengthening, flexibility, and postural exercises. Pain recovery for chronic pain issues lasting over 3 months. Balance wear for residents with balance problems. This is an assessment to see if a weighted vest can be worn to improve stability when standing and walking. Vestibular rehab, to address problems with dizziness and vertigo. And then the occupational therapy, it's a customized exercise prescription for upper body strengthening and flexibility. Shoulder rehab following shoulder surgeries or fractures. Hand rehab following hand surgeries or injuries. or if arthritis is affecting your ability to use your hands for daily activities. Low vision, for residents having vision problems, the therapist will provide recommendations for home modifications for adaptive equipment that can help maintain independence with daily activities. Pelvic health, for residents having problems with bladder and bowel incontinence, the therapist will establish an exercise program and provide educational materials for you. Let's see if that was all. Oh, it's not. Then speech therapy, which is swallowing to address problems coughing or swallowing when eating or drinking. The therapist can provide exercises and strategies to improve your swallowing ability. Voice and communication. Exercises are prescribed to improve voice quality and volume so others can hear and understand you better. Memory care. The therapist will provide you with strategies and brain exercises to improve your cognition, your cognitive reserve if you're having problems with memory. And then the last one was Thrive Screens. The rehab team offers a free annual screen to all residents which looks at 5 areas of health and wellness, which is strength, flexibility, endurance, balance, and mind. This screen helps determine if you are at risk of decline or disability now or in the future, and if you are provided with recommendations for exercise options to improve these areas of health and wellness. This screen is optional for residents, and the rehab team will notify you when it is time for your annual Thrive screen by placing a notification on your door or in your mailbox. The Rehab Thrive screen is separate from your annual wellness center appointment. The goal for rehab and fitness recommendations from your Thrive screen is for you to remain as independent for as long as possible in your current level of care at LVE. That sounds like a good idea for y'all to be doing that. Just saying.
Absolutely.
As a nurse.
And they're free, like those screenings are free. They do them regularly. And also don't skip your cognitive screenings. Do not. Memory loss is a real thing. Some of it's normal age-relating memory loss, like, word finding issues. Some of it is a sign that there may be some early onset dementia. But we can't intervene and support unless you have those screening, because there are therapies that can help maintain cognitive reserve. There are medications that can slow the decline. So this should be an environment where you feel safe to talk about the concerns you have about aging. You're changing mobility, you're changing cognition. That's what you're here for, and we want you to have those conversations with us. Okay, so next question is, do they offer exercise programs in OBT and WBC?
Yes, we do. The fitness team teaches a seated exercise class for mobility in Willowbrook Court 2 times a week. And then on OBT 3rd floor, 1 time a week. The activities team leads an exercise class weekly on each floor of Willowbrook Court and OBT.
So that looks like, having exercise programs 3 times a week. So most of us go to the gym, 5 times a week, but most people go to the gym about 3 times a week. So you get regular exercise opportunities there. Okay, so next question is, I'm trying to find the final question. If a resident needs to have an orthopedic surgery, can they receive inpatient rehab if therapy services afterwards?
Yes. Inpatient rehab is an option following orthopedic surgeries and will require temporary admission to Willowbrook Court. It's temporary. Therapy is provided 5 to 6 days a week for short term. Rehab to improve your strength and endurance with mobility and daily self-care skills so you can return safely to your previous living environment. Inpatient rehab therapy is billed under Medicare Part B services. And if you're thinking about having any kind of surgery, you need to contact Kathleen, the Director of Social Services, and also If you're an ILU, you need to contact Kim Watson because she's our nurse navigator. That all being said, this is at the back if anybody wants to read over it, and Kim's direct line, her number's on there, and so is Kathleen Honeycutt's. So there's copies of this at the back if anybody wants it.
And if for some reason we run out and we need more copies, please let me know, and I'm sure they'll be happy to email them to me and I can provide those for you or add them as a link for you to read. Okay, so we're moving on to questions about the primary care suite. So the first question is, what is a nurse navigator?
So we've already talked about that a little bit. Kim's position has been here, I think she's been here, that position's been in place for about 4 years, I believe. Vicki Trusty, for those of you who remember her, was the first nurse navigator. When she left, Kim replaced her a couple of years ago. So like I said earlier, she's the case manager. She's the one that does all the annual reviews. When you see your little letter in the mailbox, call and schedule an appointment with her because that means it's time for your annual review. During that time, she goes over any updated health history, updates your medication list, updates any advanced directives that you might have, and creates your emergency baggie. So that's part of her job and part of that annual review to make sure we've got the most up-to-date information on you in that emergency baggie. So if you go to the hospital, then it goes with you, and then we replenish it once you get back. So she serves as a resource for folks that may need a little extra help, whether it's a referral to Wellness Home Services, which Lucy will talk about a little later, or if you just need advice, if you've got a medical problem and you need a referral to another type of specialist, she can make recommendations as to who that might be, and then if needed, reach out to your primary care provider, whether that's me or off campus, and help that happen. For instance, like a physical therapy prescription. If your balance is off and you discover that you need some therapy services, she can help facilitate that through your primary care provider. So I think that's one other thing that I needed to mention about her role. But she's there for you guys. There are no dumb questions. She welcomes questions all the time. Her hours are Monday through Thursday. She works 10-hour days, and she's typically not here on Friday unless there's a special circumstance. But certainly don't let that, you can always call us on Fridays because I kind of am her backup on Fridays if there's something that needs to be done from her position standpoint. And feel free to reach out anytime.
This next question is very important. I want you to open your ear holes so that you can hear the answers. The question is, do I need to move if I do not score well on my cognitive test?
No. A number is just a number. We look at you. We look at your support system. We look at all the things, okay? Our goal is for you to stay as independent as you can for as long as you can, okay? But if we start, that's another reason for the importance of the annual review. I function a little different as a primary care provider. Your primary care provider off campus doesn't have the luxury of spending 30, 45 minutes or an hour with you, okay? They see you a couple times a year for 10, 15 minutes. We live with you, okay? We see you every day. We interact every day with a lot of you. We see you. We see the subtle things, okay? And the purpose of that annual review, if you score a 28 out of 30 one year and you come back a year later and you're at a 15, that's a big deal. That's a trigger that something needs to be done, and we reach out to your primary care provider and say, hey, this is what we're seeing. Was their score last year. This is their score this year. We're letting you know. And she can also send a scenario of some things that we might see that they might not, okay? Some people score a 12 and they're still able to feed themselves and dress themselves and take their medicines and all the things. But that, again, we see that, we know that. You're more than that number, okay? Again, hear me when I say that. But, you know, if we start expressing concerns to you and say, hey, we're seeing this and we think you need a little more support in your home from your kids, from Lucy's department. If we can get a little support in the apartment and help you, if you're not taking your medications quite right and you need some medication help, that's what Lucy's folks are for, okay, and her department. We can keep you in independent living a lot longer, and I'm talking maybe several years before you need a higher level of care, okay? So, again, we see you and not the number. But if we recommend a higher level of care or a service or whatever, there's a reason. And those of you who are my patients know that I'm very transparent, and I'll tell you the truth. And the day I meet you, I'll say, you're going to stay where you're at, but when I say it's time, okay? But I'm not a dictator, it's a partnership. Mm-hmm. That's how I treat my patients. It's a partnership. We work together. And that's the function of the primary care suite, is to work together with all of you on whatever level, whether you're my patient or not. Kim's role is to help facilitate your needs. And if you're not sure what you need, that's Kim's role too. She can assess and make suggestions, okay?
So if you want a great example of what loving kindness looks like in action, that's it. Because if you truly care about the people you serve, you're able to have the honest conversation and say, hey, I'm seeing changes. It's time for us to have a real conversation. And those don't come lightly. So know that they're done with a lot of care. All right, so the final set of questions are for our wellness home services. So Lucy, you're on. The first question is, where are we located and how can I come to see home services?
Well, good morning, everyone, again. So first thing before I answer that question, you'll notice that we have a new name. So we were previously Axe Home Services. We have been renamed to Wellness Home Services. I realize that's very confusing for everyone because Angeli was wellness. Now she's primary care. So that's going to get some taking used to.
It's confusing for all of us.
Yes, we're all adjusting. So we go by home services mostly. So if you're looking for home services, that's going to be me. Where am I located? Currently in the basement. So if you need me, you can't find me. I'm just kidding. With that being said, we are working on hopefully getting to resident level at some time, because we are now offering walk-in hours. As a registered nurse, I will be open every day, Monday through Friday. Right now, it's going to be in the primary care suite, so Angeli's office, during the hours of 12 p.m. to 1 p.m., so lunch. So if you're in the bistro, you have some eye drops you need administered, some ear drops, an injection, a wound that needs to be looked at. That would be something that I can handle. This is a fee-for-service, so that means it is a nursing service. It is not covered by Medicare. So I just want to make that very clear. I do have a flyer. It is also going to be on K4, but we are starting that March 23rd, so 2 Mondays from now, and that will be from 12 to 1. But hopefully that will change soon, and we will have a location that you can come see me.
I have one more question to ask you, Angeli. I forgot to ask it. So before I finish the home care service, I do want to ask this one question. What does the wellness office have to offer, and the benefits of having Angeli as your primary care provider?
Okay. So as most all of you know, I've been here 8 years. I'm a nurse practitioner. I've been a nurse practitioner almost 28 years now. Makes me sound old. So I offer primary care services as your primary care provider in my office. So, you know, You don't have to get in the car and drive. You just got to come down the hall. So I do Medicare preventive visits. I do sick visits and for my patients. Again, the paperwork stuff to get to a higher level of care, it's easier for me to do it rather than Kim having to call, all over and be dependent on your primary care provider to fill out that paperwork that you need to move to a higher level of care. Because trust me, I've worked in a normal office and they're seeing 25, 30 people a day, sometimes more than that, and they don't have time to fill out paperwork. So their medical assistant fills it out, they put it in front of the provider and they sign it and get it back to us. But sometimes that's a week. It just depends on the provider, and it's very specific. I do bill insurance. I had Sandra send me a copy of what the plans that I'm on right now. Traditional Medicare is the majority of what I see. I'm also credentialed on Cigna, Humana, TRICARE, and United Healthcare products. The credentialing team at corporate tries to get me on every plan that's out there. Scott sent me an email earlier this week about an Ask the Director question regarding Blue Cross Blue Shield, because I know some of you have that as your primary insurance. Blue Cross Blue Shield at this point in time does not credential primary care offices that are housed on the property of a CCRC. Don't know why. If you've got Blue Cross Blue Shield and you want that to change, call your customer service line and say, hey, we want this, can we change this? I got an email regarding Aetna in December. Aetna's provider panel in Hall County is full, so they're not going to credential any more primary care providers in Hall County. Again, if you have Aetna Medicare Advantage, call your plan. Say, we want you to credential. So the one caveat to that is with regard to insurance. If you have out-of-network benefits on one of those plans that I'm not on, you can still come and then we'll work out the out-of-network benefits. I can still bill the insurance and they'll pay what they'll pay, okay? For those of you with Medicare Advantage plans, those have a copay involved, $20, $25, $30, whatever it is for a primary care provider. You will see that copay appear on your monthly statement at some point. It might be 3 or 4 months down the road for a visit 4 months ago, but it'll show up at some point because sometimes the billing cycle just takes that long. Because we only have 1 or 2 people in the whole company, and granted there are 26 practices for in each corporately, so there's a couple of billers that post those fees. So you might see me in January, but you might not get that visit posted to your statement. If you have a copay or the Medicare 20% balance, you might not see your balances show up until later. So that in a nutshell, the benefit is I'm here. If I'm not in the suite, I'm never without this, okay? My girls can communicate with me. Willowbrook can communicate with me. OBT can communicate with me anytime they need me, okay? If I'm off, typically I have somebody covering for me, but if I don't have coverage, I'm still around. So, and those of you who are my patients kind of know that.
Well, Lucy told us how we can find her. Can you tell us what services home care provides?
Yes, so we provide a plethora of services, and like Angeli said, home services here is here to keep you independent as long as possible. So with that recommendation from Angeli or Kim or anyone that says you need to consider these options, we have a plethora of them. So we do anything from lifestyle services, which can be light housekeeping, pet care, plant care, changing your linens, anything hands-off care we offer. Then we go into personal care services, which is ADLs, assisted daily livings. So that may be helping with a shower, helping get dressed, helping with your medications, things like that. The next step would be medication management. That is where myself or my LPN come and refill your medications every 2 weeks. We take that off your plate. We plan them out in little planners, And then we contact your physician for refills. We pick up your medications for you. We do all the things that have to do with your medications. We also help with Kim with putting them in the emergency baggies. We replace those every month. So there's that, and that also comes with medication reminders. So that's one of my caregivers coming how many ever times a day you take your medications, and they hand them to you to make sure you're getting them. And then I also offer care management, which is where I go and attend all of your doctor's appointments, write a report of what the doctor says. If your family has any questions, I ask those questions. I kind of maintain your calendar of what doctor's appointments you have. If you want to follow up for the GI doctor, I will make that follow up for you. I communicate interdisciplinary with either Angelique, with anyone here. I communicate with them and get that stuff set up and ordered for you as well.
So, you know, that it's like a bridge. It provides a bridge. So if you're somebody who knows that you're needing more support to maintain independence in your home, or you're a caregiver for a spouse that is needing more care than you can provide them, but you're not ready for them to move to another level of living, home services can act as a bridge. So tell me a little bit about how scheduling and staffing work with home services.
So a lot of residents think that we have people sit here on standby. We do not. They are paid. They are here for a set schedule. So our schedules are produced essentially a week ahead. So we set their schedule, and obviously we can change it, move things around. You know, if you call and say, I forgot I had a doctor's appointment, I can't do 11, can I do 1? Then we move things around. But we don't have anyone sitting downstairs just waiting to go and do things. Unfortunately, that's just not how we can function. So everybody's schedule is typically set. We have about 20 caregivers that you will see roaming the halls. They should always have a name tag on. And they can do just about anything. They range from independent living. They even see people in our skilled nursing facility as well by doing transportations, laundry, other things, companionship, things like that. So if you want to be a set schedule, we can send you a schedule weekly. If you just want to call us as you need us, then you can call us as you need us as well.
Okay, well that concludes our set of our questions. Now I know you all have questions, and
Vicki,
probably plenty of them.
Can I interject just
Yes,
for a second?
please.
Joyce Cornett is she's our culinary director over for Willowbrook Court and Oak Ridge Terrace. And she couldn't be here because she don't work Fridays. That's not her schedule. She works Sundays. So she did send me a set of just basic questions that people ask her, and I have the answers if y'all want me to go over them.
Please.
So the first one was, how many meals do I get here? And then it says, if you'd like, except Sunday. So I guess the question is how many meals they can get in like Oak Ridge Terrace and Willowbrook Court. So it's 3 meals a day, and it's breakfast, lunch, and dinner. And you can order off the menu, off the menu in the bistro, and they'll deliver it up to Willowbrook Court or Oak Ridge Terrace, if that makes sense. Like if you don't want what they have, if you want a hamburger or pizza instead of what they have on their menu, you can order that ahead of time, and they'll deliver it to you in Willowbrook Court or OBT. Can a guest or spouse dine with me? Yes, your spouse will have a meal credit taken from their dining account, just like if they were a guest. So that being said, if you do have a guest, it's $10 for lunch and $16 for dinner. But you do have to let us know ahead of time so we can set a table and order the food and all that kind of stuff. Can I get food delivered to my room for no fee? Yes, you can in OBT, but you can't forever, only if you're sick. And then if you don't want to come down to eat, we're going to start charging you for delivery. Now in Willowbrook Court, you don't have to go to the dining room to eat. They'll deliver your meal in your rooms every day for no fee. What if I have a special dietary need in Oak Ridge Terrace? That's fine. We'll take care of you. We can do special dietary needs. And then this is for Oak Ridge Terrace too. Can I still go to the bistro or Mountain View? Yes, you are more than welcome to go dine in those venues at any time. Just let them know where you live. You live in OBT. That way it won't be an added charge onto your bill. So that was it.
So that's a great benefit to know. It's just when you're in OBT WBC, your meals are included, right? And so if you decide that you want to dine in the bistro or in Mountain View, it's treated just like your OBT WBC meal. Okay, so we're going to open the floor for questions. We have a couple of mic runners. Again, please wait till that mic gets to you and hold it close to your mouth, please.
Just curious, what is your occupancy rate in OBT and WBC?
I can answer for OBT. Right now, our occupancy is 46, and we only have 50 beds. And I know full in Willowbrook Court is 64, but I don't, what's today's census, Madeline?
Today's census is 56.
So she's got some beds available. I do not.
Oh, I see a question over here.
How many residents use the primary care as their main doctor?
Right now, I haven't run a list lately, but I would say 225-ish. So, and I've got probably 6 or 8 more in the next few weeks that I'm getting in. Probably this first quarter, I will have added 12 or 14. Last year, I added 56 to the practice.
I know y'all are going to cringe at this, but we need to know where our friends are living and when they move. I know about HIPAA. I don't want to know about their medical issues. I just want to know that they're in memory care and I need to go and see them.
So those transitions, we're not going to publicize them on the link to let you know that they moved to another level of living, especially if it's going out on an email that could be shared openly. But you will see, if you look at the updated roster for your phone roster, that there's a change of location and their exact address, so you know where to find them and how to contact them. But it's not something that we publicize in the link or anywhere, because they may not want everybody to know that they've made that transition yet, and that is their right. Okay, so that's updated when it's a permanent move. So yes, and we do always want you to maintain those connections, but we have to handle it delicately, because not everybody wants that publicized right away, because those transitions aren't easy. And so, you know, the word gets out around here pretty quickly. I mean, I think that, you know, things get shared pretty quickly. And again, once those moves are made permanent, like Julia said, there's a change in their residence on the contact list, so you know exactly where and how to contact them. Oh, we have a question over here.
Whoa, that's very, whoa. That was almost like God speaking.
It's your conscience.
How long is the list? This is a twofold question. How long is the list for Willowbrook? And like, how many people are on it? And how long would you expect it to take for the last person on the list to be able to transition into Willowbrook?
Willowbrook or OBT, ma'am? Willowbrook or OBT? Which one?
Assisted living.
OBT.
Assisted living.
So there is a list in Oak Ridge Terrace, and right now that list has 20 people on it. So I go down that list. Whoever's at the first, who's at number one when a bed opens, I offer the bed. So don't fret about the 20 people on the list because I can get through 10 before somebody says, yes, I'm ready to move. But I keep them on the list. It's an ongoing list. Does that answer your question?
Either way, but I have a further concern. It sounds like there's really, if I don't really think I'm going to need that and for a couple of years, there's no point in my putting myself on that list sooner than later, right? If I feel like I know eventually I'm going to need to be there, probably we all will, but is there any, if my health concerns are not that grave right now, is there any concern for me putting myself on the list right now? And I may not even need to go for 2 or 3 or 4 years.
I guess maybe the question is like, when do I know I need to put myself on that list?
Oh, I think that simplifies it. Thank you.
Well, sometimes, unfortunately, we don't know because things happen, and you may lose the ability of something that you don't even expect to. But I say, you just thinking about wanting to put your name on the list, you should put your name on the list. That way, if you're not ready when I call you, when your name comes up and I call and say, hey, I have a bed, I have a room available if you're ready to come over, or if you need it, you can say no. I don't take you off the list, you just go to the bottom of the list, but you stay on the list.
And also know that we triage some of those moves by level of urgency. Things happen, and we have folks that have an urgent need, and know that we try to get those folks where they need to be sooner than, for instance, Jan, if you wanted to go and your neighbor needed your spot, we'll put your neighbor there because they need it worse than you. So just know that we have to prioritize that. And we also, some people that are in Willowbrook for a rehab stay, once they rehab, they may need assisted living versus going back home to the independent living apartment. So those folks take priority. So just know that we work as a team to collectively help that process too.
And I'm going to piggyback on that. That's why we have home services as well. Because obviously there are 500-600 of you. There's not 500-600 beds in assisted living. While not all of you are going to need it at the same exact time, there is a list right now with Oak Bridge Terrace. So while your needs may not be you need assisted living right this second, that's what home services is for, is just to help bridge that gap until we can get you over there.
All right, I think we had a question over here. Strother?
You hear rumors pretty quickly around here. And I have a question about when a person volunteers to go to OBT, they realize it's time, or to Willowbrook. But I've heard other stories about people kicking and screaming to go, they don't want to go to Willowbrook. Who makes that determination? The family, you, who has final determination?
That's a great question.
All of the above. Mm-hmm. Our goal is for you to stay where you are, but if you become unsafe and you're not willing to pay for her services to help you stay in that apartment and you're unsafe there, that's when we can kind of pull rank and say, okay, you got to go. We don't take those decisions lightly at all. All interested parties have a discussion. People at this table, Scott, Anna, family. If you don't have family, then we're your family and we encourage you, okay? So that's how that works. We don't like to do it that way, but sometimes it has to be done for just pure safety.
All right, Kathy? Make sure
Okay.
you keep it. There you go. Perfect.
I've run this thing before, but I've never used it. As far as if you had a very quick turn for the worse that was permanent, and you needed either OBT or Willowbrook, and there were no beds, would they cover your costs for skilled nursing in the house or for another facility? Or has that never come up? Because we have paid for continuing care, so how would that work?
Sure, and I can say in the 5 years that I've been here, probably on the first year I was here, that did happen, and we do have transfer agreements with a couple of the other facilities in the area. So, and we check on you every day if you had to go over there. And luckily, things can happen or turn over kind of quickly, depending on the situation that you're in. So if you progress your goals, you may be able to go home more quickly, and that's going to open up a bed in our area. So once it opens, we're transferring you right back. We want you here. We don't want you to have to go over somewhere else, but it may be necessary. So we do have those options.
And I guess the other question that she was asking is in terms of the cost, because you pay the fees. Do we absorb those care fees?
Well, I think that's going to be handled on a case-by-case basis, depending on what your contract says, and I may defer to Vicki on that. Do you have anything to add?
Let's get her a mic so that people can hear her response. I know you love this, sorry.
If we do not have a place for you, in WBC, yes, we cover the cost of that.
Thank you.
To answer the other part of Kathy's question, if an OBT need was needed and we don't have a room, if there's a bed in Willowbrook, we can transfer you to Willowbrook and then bridge that to OBT later. So then in your life care or your modified plan, whatever your contract is, if it's a modified plan and you have long-term care insurance, then obviously your long-term, we would help file those papers and those types of things. If you're a regular resident contract, then that, your monthly fee is your monthly fee. But if an absolute need for assisted living, we would put you in Willowbrook first. Yeah.
I have a question concerning couples. How does that work when one may need to go to OBT and one doesn't? Do they both move over to OBT, or how does that work? And
A lot of times, one spouse will go to a higher level of care, and the other one, as long as they're still very independent, will remain in the apartment. Okay. But the need may be there for both of you. There are couple suites in Oak Ridge Terrace. There are how many, Rhonda? Three. 2 downstairs, 1 upstairs, and those are adjoining rooms. Occasionally, we have couples that need to go, and we don't have a suite available, so we occupy 2 rooms. You can either set up each apartment with a bedroom and a sitting area, or you can set up one as a bedroom and one as a sitting area. In Willowbrook Court, the suite would be the 2 semi-private rooms, and you'd share a bathroom. So we have that a lot. But just because one has a need doesn't mean the other one has to vacate the apartment.
And that's part of the beauty of living in an environment like this. Should your spouse need a higher level of care than you or have to have a temporary stay for rehab, you don't have to step outside to be with them. So it's a wonderful benefit of being in a CCRC. Oh, any more questions? Well, I think that this panel has done a tremendous job if that's all of the questions we have. So thank you. And know that this is really what loving kindness is providing care with you in mind. And so please continue to communicate with our team. Go tour OBT, go tour WBC, make yourself an informed resident. Thank you for being here.